Greetings, campers, and welcome to today's webinar. This is the latest in our TELUS webinar series, Preserving the Mind, Safeguarding Against Aging and Dementia. My name is Scott Walker. I am the Executive Director of the Canadian Artists Network, formerly CSARN, and it is my pleasure to welcome artists from right across Canada today to today's webinar. I'd like to begin by acknowledging that we live, work, create, and travel on the traditional territories of Indigenous peoples who have cared for this land, now called Canada, since time immemorial. We acknowledge this as part of our covenant with all Indigenous nations to share, respect, and protect the land in the spirit of peace and friendship, and to honor the future generations of all our nations. This is the second of two webinars we have presented on the mind and dementia. The first was Art and Neuroscience Together at Last. We presented it about a month ago, and if you missed it, you can find it on our website, which is canartnet.ca or canadianartistnetwork.ca, or just Google Canadian Artists Network, and you will find us. I'm sure questions will occur to you as you are listening to our expert. If you have a question, please put it in the Q&A box, or if you decide to use the chat box, just put a question mark in front, and please keep your questions as brief as possible. Our presenter has a slideshow, PowerPoint slideshow. I am going to post a link to that in the chat box as soon as he begins, so you don't have to worry about furiously taking notes or taking screen grabs of the presentation. You'll be able to access it afterwards, or even during the presentation. Our special guest, as he was last month, is a behavioral neurologist. He has a degree from the University of Chile and did postgraduate work at the University of British Columbia and the University of Toronto. He is, amongst other things, a consultant for behavioral neurology at the Memory Disorder Clinic and the Geriatric Mental Health Outpatient Program at St. Michael's Hospital in Toronto. Please welcome back Dr. Luis Fornazzari.
Thank you so much, Scott. Thank you for having me in this webinar with this distinguished audience that, as I told in our last webinar, we in the neuroscience department of St. Michael, we are so grateful that we have learned so much about mind and art, that for me is a beauty to trying to share this information with all our artists. First of all, disclosure in these times of incredible transparency that indeed I'm not compromising this talk with all of you. There will be a dialogue, by the way, with any financial or any interest in commercial advertise. But yes, I have a tremendous view with Franz Schubert and Johann Sebastian Bach. But as you will know at the end of my talk, when we, the elders, study, read with the effect of a music that you like it, that is not disturbing you, you learn more, faster, and better. So the issue about aging, dementia, how to protect the brain for aging and from dementia, it's a very, very hot subject these days in all the clinical neuroscience. This is a slide that was given to me by the head of the Queen Square Neurology Department. He thinks that maybe the future physician will treat dementia from birth, because in this iceberg, the hidden part are the ones that most likely are the cause of all the forms of dementia. So we need to control these events in order to prevent dementia. So the issue at this moment is, what are we going to do with the dementia? Artists, as always, are giving us tremendous examples that we need to keep going with our job, with our art, until the end. Not only the famous, internationally eternal painter Michelangelo, but all those painters, all those musicians, writers, artists, and even anthropologists and distinguished architects, using their creativity, talent, and productivity until very, very late in life. And we should consider, and this is one of my mandates, is art should be considered an enhancer of all our cognitive reserve capacity. In other words, with the art, we protect our brain. We use that protection not only in prevention, but certainly delaying the cognitive, the neurodegenerative disorder like the dementias. So, and why is that? Well, we know that our brain, until our last moment in life, and I want to repeat that, until our last moment in life, have the capability of brain plasticity. In other words, to regenerate, to create new pathways, even until the last minute. We know that from the old classical study of the stroke, traumatic brain injury, and the subsequent rehabilitation. But now, with the new techniques that we mentioned in our last webinar, there is no question that the brain generates ideas, facts, networks, that those networks change the brain at the same time. And that is done through the neuroplasticity. And art is a form of neuroplasticity, no question about that. From the basic neuroscience, we learn that aging is a phenomenon that, interestingly, we start to age since we start to breathe. As soon as we are, just born, the metabolic system in our body, particularly these mitochondrial, who are tiny little laboratories that we have in all our cells, particularly very active in our neuronal cells, as soon as we start to breathe, the mitochondria start to have certain defect, and they start to accumulate, potent acids, potent oxidative phenomena. So since then, our body start to get, start to get old. There are many theories how we can prevent this, how we can do things to do better. So since, for instance, the attrition telomere, I don't want to, to bore you, but all our chromosomes, these are the picture chromosomes, have a little bit, a cap. And this cap, with the years, start to decrease the size. This attrition, this losing of this telomere is a marker of disease. And there's many other markers that we know. And that is what gives us, the scientific information, what to do to avoid the chronic inflammation, diseases who are specific for aging, and at the same time, how to prevent that. Regarding the brain, this is our conversation today. Well, in spite of whatever we do with our brain, in spite of how active we are, these changes in cognition start to occur when we are 40 years of age. This is a normal way that the so-called fluid intelligence start to decrease. But we keep, even in an advanced age, the so-called crystallized intelligence, who is essentially, the word, how we talk, and all those solid information that we accumulate during our life that makes elders more wise than in any other type in our society. And this is something that is so interesting because it's not only the study that it have been done in Seattle, other study done in another part of the world, that all of them confirm that regardless of how active many of our cognitive functions start to decrease. And that is a problem when someone notices that he or she is becoming more forgetful, or is becoming less attentive, or is going to have more issues with the visual spatial or the visual perceptual function, or even with the behavioral function. So all of this is a complication to know in your GP, your specialist. So is this part of your normal aging regarding cognition? And this have been replicated all over the world. So this is a fact. The second fact is the complication that all our neuroscientists are bringing as per today. What are the reasons of certain diseases like this green Alzheimer's disease that we used to think that was only amyloid, a protein who is really necessary, but is misfolded during the disease and become toxic, or tau derivate protein, or the tau, pure tau. So we thought that all these three green were the reason that the brain of the patients who are going to develop Alzheimer's disease were having difficulty. But no, neuroscience start to find other abnormal protein. Look at this one. The alpha-synuclein is the abnormal protein that we notice in Parkinson's disease and in Lewy body dementia. But alpha-synuclein also is an abnormal protein that contaminate that brain and give the symptoms of the so-called, Alzheimer's disease. Alzheimer's disease is not a single disease. We consider, and this is almost an international agreement, is kind of a combination of multiple disorders, where this biological fact that you are seeing in your screen, plus the social, education, etc., are the ones who transform this biological, genetic, protein, etc., in the patient with Alzheimer's disease. Well, in 1907, when Alois Alzheimer described the disease, the patient was a very young patient. She was 51. This is Auguste Deter, and she had symptoms that for years we were arguing that is this a true Alzheimer's disease, the one that we see in our memory clinic these days? And the answer is yes. Auguste have a form of so-called frontal limbic Alzheimer's disease. What is interesting in 1907, when Alois described the case and in an annual meeting of the psychiatry in Tübingen, Germany, nobody asked a question after he presented the case. Nobody pay attention to that. There is histories based that the next presentation in that year, Academy of Psychiatry of Germany, a famous psychiatry at the time, were going to discuss the chronic masturbation syndrome. So the chronic masturbation was immediately after Alzheimer's disease. So the people were nervous and they didn't want to ask any question and trying to hear that, chronic masturbatory behavior. Alois Alzheimer not only described the disease, but since that time, 1907, he described and put pictures of the so-called Alzheimer plaques, that is accumulation of these plaques with toxic material that neurons are dying in the center. These are neurons. This is the space in between the neurons. And he described that. At the same time, he described that inside the neurons, inside the cell, the communication that we have in our neuron was also affected. He described that as a neurofibrillary tangles, and he described this as Alzheimer plaques. Both combined make the neuron to function very, very difficultly, and at the end, between the amyloid and the tau, who is inside this, that we discovered, 50 years later, that are the one who kill the brain, kill the neurons in the brain of the AD patient. Well, but even if you have many diseases of the central nervous system, any disease, we're going to talk about Alzheimer, but you can think about Huntington, frontotemporal dementia, or so-called Pick's disease, Parkinson's disease, Lewy body dementia, even major depressive disorder, autistic spectrum disorder, ADHD, schizophrenia, bipolar affective disorder. All of these biological disorders require many other influences to have the clinical expression. Our group, together with the group of Baycrest in Toronto, plus many other groups in Canada, we are certain that, for instance, in the case that developing Alzheimer's disease, not only you need plaques and tangles and amyloid and tau, but you really need, influencing factors that we're going to discuss during this hour. But at the same time, this influencing factor, Toronto origin, the bilingualism. If you are bilingual, you have around 5 to 7 years of protection, even when the disease is progressing, and we'll see in the next slide. If you are bilingual, you have 5 years of, insurance in your brain not to have symptoms. Art, we feel, our group, not yet universal, that have the same characteristic. This is a slide that we have been showing for many years, that the process of the Alzheimer's disease start, many years before. This will be the starting point. This will be the starting point. So we were suspecting that the process of these tangles and these plaques and these abnormal protein we were suspecting 20 years, 18 years, etc., etc. Unfortunately, until recently we didn't have any way to know about that. Now we know that when the precursor of this abnormal protein, the amyloid beta protein, the tau protein, are in the brain of the patient, we could get some samples of that through spinal tap, examining the cerebrospinal fluid, and we can see that they start, few years before. Unfortunately, very invasive test, very difficult to do in population studies, or even if you want to be sure what you have. Well, I don't think that anybody will like have, a spinal tap. There is some interesting issues that come in these few years. It's not only the so-called biomarkers. We are in a race trying to face, to found, to use biomarkers. Until now, most of them are in the cerebrospinal fluid, but some of them are coming. Don't ask me when, but some are coming that could be measured in plasma and serum. In other words, with a blood test. There are already some of them that sounds very promising. We know, obviously, have some neuroimaging who are markers, not only the PET scan, the amyloid PET, and also the magnetic resonance studies. And obviously, day a day, we're trying to, to make better cognitive assessment, more sensible, more specific cognitive assessment to detect very early changes. That was the old image that, normal amyloid start to accumulate, tau start to accumulate in the brain, and cognitive normal until, some benign forgetfulness start to occur that we invented, as we've seen the behavioral neurologists, mild cognitive impairment, and then the dementia. But what is interesting is not only that we have the abnormal neurons described by Alois Alzheimer, also the amyloid plaques, also described by Alois Alzheimer, and we know what are the content of this. And the accumulation is gradual. I put an extra information here that is not only the biological aspect that trigger, the disorder, the disease. This is a brilliant study done by a distinguished colleague of ours, Lilian Calderon Garcidueñas, a Mexican clinical neuroscientist that was trained with us in Toronto in neuropathology, that he discovered that in the central Mexico, in Mexico City, first he did an incredible study in dogs who were dying in the, in the center of Mexico, who is a city as Santiago, as Bangkok, as Hong Kong, full of air pollution, that the dogs were having, plaques and tangles. The dogs dying in the center of Mexico. And then he did a brilliant study. It's kids in street condition, again in the Mexico and center in downtown. At the age of 10, 12, already they have seen these kind of neuropathological markers of Alzheimer's disease. Very useful information for all of of the people who have seen that pollution, well, may affect your lungs, maybe. No, it affect your brain, and really, really badly. A recent study published last month, nothing less than in New England Journal of Medicine. It's one of the few very serious journals that we still have around. During a 20-year follow-up done in China, continental China, discovered that doing studies every 2 years, every 3 years, and trying to detect biomarkers of normal people and people who are going to develop Alzheimer's disease, they clearly suggest to us that around 18 years before the symptom, the patients who are going to have Alzheimer's disease start to accumulate amyloid beta protein. 14 years, the amyloid beta with the 40, the 42, who is the technique, 14 years. Tau, the abnormal protein that affect the neuron directly, start, around 11 years. 8 years, they start to notice that the brain, particularly the memory area of the brain, the hippocampus, start to shrink. And only around 5 years, those patients start to show some cognitive impairment. So this is interesting, valuable information that now we put numbers at around 18 years of age before the developing of the dementia of the Alzheimer. Already we know that we can detect abnormal protein there. Well, that was biology. That was the abnormal protein that started to accumulate. In this other part of the world, again, in JAMA Neurology, another highly respected, and as you see, a few weeks later, a totally different study in which they were following in the Rush Memory and Aging Project from 1997 to 2022, 24-year follow-up patients comparing citizens that were active, they were good, lifestyle, eating healthy, doing exercise, and maintaining that brain very active, and they die. And they accumulate the data from years before and the autopsy. And the finding is fascinating. And the finding of this study justify our conversation of today. They discovered that those elderly, active, healthy, with challenging intellectual activities, without depression, without smoking, drinking, socially, and doing exercise, 150 minutes per week. Those were the ones who have the less of the Alzheimer pathology. So we saw the biological aspect. Now we saw the social, cultural aspect. And we can really freely say this is a disease which is not only biological. This is a cultural, familial, national approach to this disorder. What was fascinating about this lifestyle is that, as you will learn today too, is that there are new medication that we're going to go briefly that are extremely expensive, and they have some of them very serious side effects. And that at the same time is not a medication that you take a pill. It's a medication that you need infusion, special infusion machine, follow up with PET scan and MRI. So it's a full system associated with this new medication that, by the way, the medication per se alone, it costs more than $50,000 per year. So with all these interventions who are lifestyle habits, you can really have a better prognosis. You can delay this biological disease. And as it said in the comment, for 55,000 years, you can provide, we can provide our patient with a personal chef for healthy food and health coaches, a health promoter to incorporate more effective lifestyle intervention. So 1 minute comment, let's do not forget that any kind of dementia have behavioral and psychological symptoms that are the symptoms that make the care of this patient quite difficult, complicated, emotionally disturbing for the family caregiver, and even emotional disturbance for the professional caregiver. So it's part of the spectrum, but we'll go back to that in a moment. We need to take care of the caregivers. That's essential. In such a way that, if the caregiver is having issue with depression, sadness, tiredness, it's going to be transmitted to the patient with dementia. Not only transmitted, because the patient with dementia, regardless of the advanced degree of dementia, the emotional intelligence and the emotional memory is the last to go. So they are, as I described in our visit to our long-term care, patients are like sponge. They cut every kind of gesture. We need to be very professional, very calm, and always very emotional, very tender in the care. And in spite that is difficult, in all the studies, more than 45% of caregivers considering that is a very rewarding activity. We're talking a lot about risk factors, right, in dementia, particularly in AD. This is only to remind you that there are many variants of Alzheimer's disease. Since Alois Alzheimer, described the disease, we have many varieties. So there is not a single disease. And second, is not only pure biological disease. So the normal aging is associated in Alzheimer's with genetic factors, the ApoE, that is a predisposing factor, but by the way, is the less frequent. In other words, the familiar form of Alzheimer's disease is less than 3-4% in all over the world. 97% is an sporadic. You don't need genetic alignment to develop AD. For the familiar Alzheimer's disease, yes. And here you have, which are we in the field of behavioral neurology, the risk factor for Alzheimer's disease. Advanced age, family history could be. the ApoE4 genotype, obesity, insulin resistance, vascular factor, cholesterol abnormality, hypertension, inflammatory markers, in other words, inflammation of the brain, Down syndrome. Unfortunately, the Down syndrome is known in genetics like the trisomy 21st. The 21st is the chromosome where this amyloid abnormality took place. So most of the patients with Down syndrome at the age of 40, 42, they develop Alzheimer's disease for the accumulation of the amyloid. And traumatic brain injury is also a well-known risk factor. There are issues in our countries, and this is studied done in New York by Jennifer Manley, a distinguished clinical neuroscientist, psychologist, that she did a study where she discovered that based in the tremendous population of New York, there was a disproportionate burden of dementia and MCI, the pre-dementia, the mild cognitive impairment, among older Blacks and Hispanic adults. So in the paper that was published, as she did, he said there is an enormous economic inequality plus historical and current racism. Something that it's good to know, and because any intervention that we want to do, should consider absolutely everybody in it. Okay, how we can prevent, how we can improve something that is starting to progress, 18 years before we can make the diagnosis. Health benefit, leisure activities, hobbies, all of these are so important that I'm going to show you immediately these new slides. Diet is no question that the diet is something that is not only because of the so-called Mediterranean diet, but a healthy diet with flavonoids, fruit, vegetables, and health. This is confirmed. This is not as a study, a multiple study, the healthy habits in food, following, the international guidelines, particularly, with the so-called Mediterranean diet. But don't forget, daily physical activity plus Mediterranean diet is the best combination, The MIND diet is one study where they use an adjusted Mediterranean diet with more phosphorus, more phosphate, more omega-3. So they call MIND diet. But again, this is important. Please limit red meat, butter, cheese, pastry, fried or fast food. 1 glass per day of wine. I always joke because the best wine is the red wine, because it have more antioxidants, more than white wine or any other liquor. There was an old study done where they comparing the benefit of 1 glass of red wine, 1 glass of beer, 1 glass of scotch. Was financed by the Scottish whiskey company. Unfortunately for the sponsors, the best drink, 1 drink a day, is red wine because of that antioxidant property. Well, that is what we know. There is other study, this one very imaginative study called COCOA study, where they compared the extract of the dark chocolate cocoa with the other, and they discovered that there were no difference. On the contrary, if you follow the previous slide, is much better than the cocoa study. Well, it's not only preventing. These nutraceuticals and these food are protected. So all the scientific evidence is that they improve not only the function of the neuron, they help the other brain cells around the neuron. They are able to handle better the toxicity induced by, all the things that we do during the day. Well, there was one study that it became classical, Professor Livingstone from England. In 2020, he described all the modifiable risk factors, And following these factors, we can prevent 40% of worldwide dementia, prevented or delayed, as we talk about when we have the bilingualism. With bilingual, we delay 5 or 7 years. Early life, less education. Midlife, hearing loss, obesity, hypertension, traumatic brain injury, alcohol ingestion. And in later life, the social isolation, physical inactivity, depression, smoking, air pollution, and diabetes. Came another factor here, which is extremely important, which is sleep. Sleep, the regular 6 to 7 hours per day, is again a risk factor that we need to take very serious. And this 2020 paper plus the interventions done, again, this is Livingstone, with education and the hearing loss and all the 25. The Finnish clinician did a study that is called FINGER, or Finland study, where they use in a group of patients and a group of control, all elderly, activities of very good diet, as I mentioned before, physical exercise, well-controlled, good control of the circulatory system, diabetes, hypertension, a lot of social activity, and keeping that brain active. That was the FINGER trial. After 2 years, the findings were published, and it's fascinating. Why? Because more than 25%, they improve in all aspects, in their life. More than 83% of the FINGER participants improve in the so-called executive function. In other words, the prefrontal function, the functions that have to do with the multitask, with the working memory, with the insight about what to say, what not to say, and more than 40% in memory. So it's not question that all this slide that I'm giving you with proof studies, when are done in a population in a certain country, or is in Finland, that look at the incredible improvement after 2 years following these simple but very serious kind of activity. Don't forget the sleep, essential, because we discovered in the last few years in the basic clinical study, poor sleep not only affect, induce atrophy of the brain, induce some what we call white matter hyperintensity, atherosclerosis, so the circulation in the brain decrease, is the garbage, the cells in the brain that are take away the garbage are affected. And also, obviously, what is the most important is that they accumulate amyloid, that abnormal protein that have the so-called, amyloid plaques described by Alzheimer. So, and this is very, very important to know. We sleep, between 7 and 8 hours. The elderly have a bipolar system that elderly need in the middle of the day a rest. But usually we have all these stage 1, 2, 3, 4 very well studied. And also we have the rapid eye movement, this red period where we dream. This is the only time that we dream. And it's in this time when we clean our brain. And if we don't have enough 5 or 6 REM period, we are going to have all these issues. And particularly, and this is based in JAMA neurology again, sleep apnea is not corrected, it's going to have all these difficulties, not only, strokes, but also Alzheimer's. And all of this is increase the risk of incident of dementia, and not only Alzheimer, but also vascular dementia, strokes, etc. And this is essential that we need to understand as human beings, based on our most wise evolution. All the living beings need to sleep appropriately in order to have a normal life next day. So the sleep is not only good for the cardiovascular system, hormonal regulation, immune function. In other words, if you have an immune disorder of any kind, poor sleep is terrible, and brain health. This is a recent slide that I put last night because yesterday I was in an international conference with European colleagues. This is the latest that our colleagues from Europe considered that risk factor that could be modified in Alzheimer's disease, and what are the protective factors. It will be there for you, as Scott suggested, could be with you all the time. So they are very precise in the sense that they involve other one that we don't. Hyperhomocystinemia and anticholinergic medication. This is medication that we do not use in the elderly anymore. But again, protective factor, all the same. Bilingualism, Mediterranean diet. My diet is the same as the Mediterranean, with more omegas. They suggest ketogenic food, a little bit risky because that increases acidity, but a lot of fish intake, cholesterol control, etc., etc. So all healthy stuff. Activity is something that is essential that we need to consider today. the suggestion from the Canadian Neurological Association, American Neurological Association, American Cardiac Association, blah, 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 is that we need to have at least half an hour a day for 3-4 times a week of exercise. Exercise that could be from the simple walking to the more elaborate exercise in the gymnasium. The advice for the walkers is that the walking should be fast, should be in such a way that it will increase your heart rate, that you will feel that your pump is really accelerating the function. This is the only way that through the heart, to the brain, increase the circulation and decrease, the amount of toxic in your brain. Half an hour a day, 3 to 4 times a day. Better if you do it every single day. The finger study, they are using 150 minutes per week. And it's scientifically proved. For instance, the group of you who are in the 50s, that you are doing some sport, you have less plaque, less Alzheimer plaque 25 years later. So at the age of 75, if you're doing exercise, you are going to have less plaque. In other words, less symptom of Alzheimer's disease. If you're 70 and you are active, also you're going to have less cognitive decline and also less brain atrophy, and with the position of a beta protein. So the exercise is a good vascular health, and then protect independently against the amyloid, and also protect your brain of a stroke or any other, if even traumatic brain injury. This is the only advertisement propaganda. Our group discovered through the music, when you are exposed to long-known music, your brain is activated, not only in both sides of the brain, but also in its cerebellum. And as we talked last time, cerebellum is a very important area of the central nervous system that have to do not only with coordination, fine motor coordination, but with language, memory, and affection. In all those areas, exposure to long-known music activate prefrontal, emotional, motor, subcortical areas that are, and when someone starts or have a silent Alzheimer's disease, through that long-known music exposure, the neuroplasticity exerted by the music, protect the brain of this patient. We don't know yet for how many years. 5 to 7 if you're bilingual, but we want to know how many years that is. And if you are a privileged musician, the mechanism is different and is more effective. So something to think about, what to do in your free times. Studies, scientific studies, meditation and music, tremendous effect in the brain, not only in the day-to-day function, but particularly when they measure the so-called blood biomarker. They notice that any of the meditation that are in this study using the KK meditation that is described in one of them, So that issue, again, give a tremendous power to meditation, to music, and together are even more. So please, please learn and listen music. As we described the other time, we record better anything that we learn under the effect of music. And at the same time, with music, you activate not only all of these neurotransmitters who are very useful for our mental status, but particularly, and for our talk today, memory, attention, concentration, and polarity. Briefly, we have a few minutes. There are new medications specifically against the amyloid, this plaque described by Alzheimer that's, that strangle the connection of the neurons and kill the neurons. There are two who were approved by the FDA of the state. We haven't been approved yet in Canada or Europe. And one is called aducanumab, the other lecanemab, are all, antibodies. And in a positive way, the one that few years ago were trying to stop the disease, to cure the disease, 350 potential new drugs failed. Year 2013. 2022, Jeffrey Cummings, our highly respected behavioral neurologist from the state, we have 143 new agents, 331 in phase 3, also ready to be tested, in 82 in phase 2, and a lot in phase 1. So hope of a cure is there. But at the same time, cost benefit of the one that we already have, the $50,000 from your pocket, plus important system to infusion machines, prepare laboratory, having PET scan and MRI available to follow either aducanumab or lecanemab. So almost impossible in our health system. So the same Jeffrey Cummings, this is from February this year, they think, together with some European people, that the chance to prevent Alzheimer's disease is sooner than you think. But the prevention is through the healthy state, the healthy habits. This is very simple. This is a patient who received lecanemab, one of the drugs approved by the USA FDA. Before receiving the lecanemab, these are the so-called white matter hyperintensity that practically everybody over 70 have in their brain, white matter hyperintensity. In the past, we used to call atherosclerosis. Then, after the trial with the new drug, look at the amount of atherosclerosis that she developed. She died, by the way. And at the same time, they noticed micro bleeds in the brain before dying. And when she died, look at the amount of micro bleeding all over the brain. That is the complication of this new medication that we call, in a very benign name, we call ARIA, abnormal radiological inflammatory amyloid lesion, ARIA. I don't know why the people from the opera allow that. The pressure for approving this, it's, our neighbors from the south are very, very fast in trying to approve things when business is business. But again, it's something that we need. I want to finish with a very positive one. This work of art that you think that maybe, a famous painter did. No, this is nature. This is cells from the dental pulp that are in the process experimentally to be transformed in neurons. You see, here we have 5, here they're starting to develop more. So these matrix cells, also known, that stem cells, can be transformed in totally potential cells that can we use for not only genetic or in neuronal deficit or in any other condition that requires when our brain is under stress. I cannot end without my logo. All schools should be art school. And thank you so much for your attention. And I'm happy to stop sharing and trying to answer your most interesting questions that are coming.
Thank you so much, Luis. As always, a fascinating presentation. And we do have some questions. In fact, it's interesting, your talk about sleep has prompted several questions. So why don't we start with those? Do these 6 to 7 hours of sleep need to be continuous, or can they be broken into several shorter periods?
Fascinating question. We human beings, when we are older, we start to accumulate more fluid in our genitourinary system, and we need to get up and go to the bathroom. So this is absolutely necessary, goes away. All the studies that when the people are able to go to the bathroom, come back and fall asleep, that is not considered interruption. So practically, if go to bed and start to sleep again, that is a normal. The problem is when some come back and take so long to fall asleep. That is an abnormality that now is easy to correct. And for that, we need good sleep studies. These days, the sleep studies are not necessarily so elaborated like in the past, the so-called polysomnography, that you go to a sleep laboratory, sleep in a different bed, full of wires in the head, in the chest, in the legs. That's not normal. So now there is new intervention, portable sleep detector abnormality, and with that, the sleep specialist can make the right suggestion and make the right diagnosis why you are not sleeping the 6 or 7 hours required.
Thank you for that. Also on the subject of sleep, and specifically sleep apnea, if one starts using a CPAP machine after several years of interrupted sleep, can one arrest the decline from those several years of interrupted sleep?
Unfortunately not. If you have a CPAP machine and you notice in your follow-up that you don't have, sleep apnea period, you need to use that and follow the control at least every 2 years. Because the issue is that the sleep apnea is the one who we need to avoid. Because the sleep apnea means that you accumulate during the apnea period all these toxics that I mentioned to you during my talk. It's possible that some people don't require, after, if they decrease weight, for instance, or if the machine is not required. But I don't know. I don't know cases that if you started and if you don't decrease weight, or if you don't have good exercise, that you're going to discontinue the use of the CPAP machine. Practically is forever. I cannot leave this opportunity. I have one of my patients, unfortunately it was a friend of mine too, that have some problem with sleep apnea, that he said that he couldn't use the mask, he couldn't use the nostril. And I insisted, okay, you really need to go to the laboratory in order to find something, because sleep apnea is a risk of stroke, is a risk of dementia. And 3 weeks after, he had a mini stroke when she didn't use the CPAP machine. So the short answer, unless the physical characteristic of the patient suggests not to use CPAP machine, the one that are under the CPAP machine should use the rest of his life.
Thank you for that. One more question on sleep is: are there risks with sleeping too much, like 10 or 12 hours per day?
Well, sleep is a biological rhythm. It's a genetically, dictated since we are born. Some people are happy with 5 hours of sleep. Other people are happy with 9 hours of sleep. So it depends how you awake next day. If you need 10 hours and you awake fresh, creative, ready to produce music or writing or painting, 10 is your time. So there is not, the problem is less than 6 hours. And if it's interrupted, that is the problem.
Okay. A couple of questions on music and its benefits. Does the type of music make a difference that you're listening to?
Sorry, could you repeat again?
Does the type of music make a difference in terms of its benefits for those with or those who are trying to prevent Alzheimer? For example, classical music versus rock music.
Fascinating question. In the past, music is music. I don't know who can describe this is good music or this is not good music. Anyway, is the music that you like it? Is the music that you make you feel well? Could be, as in personal case, Mozart and Johann Sebastian, or other people could be cha-cha-cha, or could be, merengue or vals. Doesn't matter. It's the music per se, the one. But we need to discover, because some short while ago, in our visit to our long-term care facility that we do every single week, well, we suggest music, music, music. Stop this TV and put more music. So the patient, but the issue was, what would be the best music for the group? Right? Some of them, they say, oh, country, they're soft rock, other heavy rock. So it's the music that you like personally. So that's the reason why now Alzheimer's Society in Toronto create this modular thing that the patient have their personal music selected and they listen to that, and you notice that they are very happy listening to music. Yeah.
Okay. You also use the term long-known music.
Well,
does that mean music that your brain's already familiar with?
Yes, music that you are familiar, music that you know, music that are in your memory system. But the memory system in music, as I mentioned in our slide, is not only the aspect of memory for the day-to-day music, day-to-day memory, day-to-day activities. The music for memory is different. Music for memory activate emotional networks in the brain that are associated, either with happy moment, sad moment, and neutral moments. So the memory for music is specific for music, different from learning where is the capital of Italy, where is Mozambique, etc.
Okay, let's move on to exercise. The 30 minutes of exercise, does that have to be continuous or can it be broken into, say, 15-minute slots?
That is a fascinating question too, because the idea is allow the heart pump activate through circulation during 30 minutes all the system in order to decrease the amount of toxicity that we accumulate in our brain during the day. So that the symbol. I'm not so sure if you could do 15-15. I think that physiologically, in order to be beneficial, should be 30 minutes minimum, 3 to 4 times per week. And that is the suggestion of all our academies.
And I think that's all we have time for, Louise. Thank you, as always, for a wonderful presentation. This has been fantastic.
Thank you so much for inviting me.
Oh, it is our pleasure. And we should do it again really soon.
For sure.
Okay.
Happy to.
Thank you to Dr. Luis Fornazzari. Thank you also to our series sponsor, TELUS. And most of all, thank you for being here today. Without your presence, this would have been pointless. We will be posting a video of this webinar on our website probably in the next 24 hours. So if you wanted to reacquaint yourself with Dr. Fornazzari's information, you can do that. And don't forget, in the chat, at the top of the chat, you can download the slides from Dr. Fornazzari's presentation. So also, when you do look at the webinar, the video, don't forget that we have lots of other videos of all of our webinars on copyright, on social media, artistic legacy preparation, wellness in winter, identity theft, fraud prevention. They are all there for the viewing. So thank you again for joining us today. And until we meet again, take care, be well, and have a creative day.